Childbirth perineal trauma affects millions of women worldwide. It has an incidence of over 91% in nulliparous women and over 70% in multiparous women. So it is very common. It can have a potentially significant impact on women's lives, affecting daily activities, psychological and psychosexual well-being, and the overall quality of life. The most common injuries that are related to childbirth, especially those ones related to vaginal childbirth, involve trauma to the vulval, vaginal, and perineal skin, the muscles underneath, the perineal muscles. They can be associated with increased risk of bleeding during childbirth. And additionally, in some less common cases, there may be injury to the labia, to the clitoris, to the paraurethral tissues, and other areas of the birth canal, of the vagina, the vulva, and the perineum, as well as in some cases, the anal sphincter. There are several risk factors that can affect the incidence, the chance of these injuries occurring at the time of childbirth. There are risk factors that are related to the mother, the baby, the process of labor and delivery. A large size baby, a disproportion between the maternal anatomy and the position or the size of the baby, other factors such as diabetes, which results in large babies in pregnancy, may also play a role. Factors that are related to labor and childbirth could be related to the pace of labor, very prolonged labors or very quick labors may also be associated with higher risks of perineal trauma. The position of the baby, the use of instruments such as forceps or ventouse can increase the risks of perineal trauma. And there is a number of other factors that could increase these risks and result in higher rates of childbirth perineal trauma. It is very important that women are informed during pregnancy about the process of labor and childbirth, about the risks of trauma, about possible ways of preventing to some extent this trauma from happening, and the possible need for treatment. For example, very superficial trauma that is called a first-degree tear and involves only the skin of the perineum, the vagina, or the labia, often does not need suturing and will heal spontaneously during the postnatal period. Cases of trauma that involve muscles would require suturing at the time of childbirth. Cases of trauma that there are healing complications may result in chronic pain, in difficulties with sexual intercourse, in issues with self-image, and in some cases when the anal sphincter is involved with the continence of flatus or feces, with anal continence. There are treatments available. Pelvic floor exercises both before and after childbirth help improving the quality of the muscles, preparing the pelvic floor for birth, and rehabilitating the muscles following childbirth. Prevention of childbirth trauma is challenging as the natural progress of pregnancy, labor, and delivery can be often unpredictable. From the mother's point of view, maintaining a healthy lifestyle, healthy diet and weight during pregnancy, following the advice of the specialists and the regular visits to the antenatal clinics, regular reviews by the midwife or the obstetrician as required, will identify any risk factors and in many cases help mitigate these risks. Pelvic floor exercises help to have good pelvic floor muscles, good control during the time of labor and birth, and reduce the risk of perineal trauma. Good hygiene after the birth, according to the degree and the extent of the trauma, different advice is usually offered to women about the healing process, will ensure a healthy healing of the tissues. And of course, continuing with the pelvic floor exercises postnatally will help rehabilitating the pelvic floor muscles. In some cases, additional interventions are possibly required if there are healing complications postnatally.